Welcome to This Week in Health IT with our continuing series on coronavirus prep. We've moved from understanding the health IT problems to start looking at the solutions around these problems. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. Before we get going, I want to make you aware of 3 resources for those in health IT during the crisis. The first is for CIOs. I'm currently helping my coaching clients as a sounding board and advisor through this time. If you'd like to connect with me over the next couple of months to experience coaching at no cost, shoot me a note at bill@healthlyrics.com. For anyone in health IT who finds themselves in uncharted territory and wants to crowdsource solutions with a team of seasoned professionals, we've set up 2 ways that you can do that. The first is a Slack channel, and the Slack channel is monitored and supported by our sponsors, VMware, Galen Healthcare, Sirius Healthcare, Starbridge Advisors, ProTalent Advisors, and myself, Health Lyrics. The Slack channel allows you to get your questions answered around telehealth, VDI, you name it. There's great resources in there. There's technologists, there's CMIOs, there's CIOs, just great resources. If you want access to the channel, send me a note at slack@thisweekinhealthit.com. That's Slack, exactly how it sounds, SLACK @thisweekinhealthit.com. And we will get you set up immediately. Our sponsors are also supporting an email channel at support@thisweekinhealthit.com. If you just want to shoot me an email over, I will get you routed to the expert in the area that your question pertains to from our group of sponsors. I really appreciate our sponsors stepping up to provide these services to our listeners and to the industry. Now to our guest. San Banerjee is the VP of Digital Experience for Texas Health Resources, and I'm excited to have him on the show. We're going to talk telehealth specifically and how health systems are piecing these things together. Incredibly creative, incredibly resourceful. I look forward to this conversation with San. Now to our guest for today. San Banerjee is the VP of Digital Experience for Texas Health Resources. Good afternoon, San, and welcome back to the show, former guest of the show.
Happy to be here.
Yeah, I'm excited to talk about you. I saw a LinkedIn post that you put out there, and I was really intrigued. It said, I'll just read it. If you're seeking advice, recommendation on how to implement telemedicine in your health system or regional health centers to respond to COVID-19, please contact me and would be happy to help. And here's what we're finding. People are scaling these things up, and there's all sorts of need, and telehealth is really seeing a boom right now. But a lot of people on our Slack channel and other things where people are asking questions, they're trying to figure it out because there's a lot of challenges. So what kind of things are you seeing, and then what kind of things are you advice are you giving people as they implement this?
So I think these are very uncertain times, Bill, and telemedicine used to be an and in many things for providing care. But the way I'm seeing this is primarily in the critical path in terms of how we can give and distribute care, ensuring that we can do virtual care, keep our providers safe, and also ensure that we can do it in a very quick and fast way. So when I put the post in LinkedIn, I think my whole aspect was, all health systems have different technologies in place today, right? And how do we bring all those technologies that we have to really provide telemedicine? I'll give you some examples. Many health systems have Skype, for example, that they use for collaboration tool within the system. Skype can be used for telemedicine. And I can help setting up Skype to ensure that you can see your patients using Skype. It may not be an integrated experience, but it will be a good place to start. Similarly, there is FaceTime on the phone. Now, the new regulations that CMS has declared 2 weeks back helps all the providers to really be on the phone, be on Skype, and be doing the telemedicine the way it has never been thought or done so far.
Yeah. So we break these things down. A telemedicine platform has a handful of things. One is it has a queuing system, so it queues up patients. It has an education platform, so while you're waiting, they're streaming videos or those kinds of things. Some of them have an input mechanism where you're actually typing in some things before you actually see the physician. Then you have the teleconference technology, and then generally you have a documentation platform. And I think what people don't recognize in a lot of these telehealth platforms, the documentation platform isn't the EHR, it's the telehealth platform. And it's so anyway, so we're going to break these things down. And I want to walk through it with you. So if I start using
Sure.
Skype or I start using FaceTime, those are great, but they're designed to be one-to-one kind of things, and there is no queuing mechanism. So how are you going to set up those calls? Are you initiating outbound calls to patients?
So I'll kind of walk you through a couple of scenarios here, right? So just looking at Skype, right? Skype is a technology to use to do teleconferencing, but you can put Microsoft Teams to do queuing.
Okay.
So anybody having a Microsoft ecosystem can use Microsoft Teams for doing queuing, and then use Skype to do the teleconferencing or whatever the conferencing that is needed, and then keep the EHR to do documentation. So in this whole process, there are three pieces together, and those three pieces could be stand up in a week, less than a week. And Teams is already available, and people can use that for collaboration that is needed.
Yeah, so that's fascinating. So you bring Teams into, so the EHR should be the documentation platform. You just need a big enough screen, and they're going to do that. And I think that makes sense to a lot of people. Talk to me about the Teams as a queuing platform. So, what are you giving your patient community to say, hey, so here's what's happening. A lot of our primary care physicians, their offices are empty. And they're empty because people are afraid to go to the offices, but they still want to see patients. They still need to see patients. So we're standing them up with telehealth very rapidly. How do we stand up Teams as the front end system, and what do we give the community to get in line to see that doctor?
So I think the Teams, the way it works is the Teams is given for providers. So providers will have the team access, right? Anybody having an Outlook account or whatever the account looks like, so they can be set up on the Teams. The patient typically gets an request, or they can initiate a request from their perspective. All it does, it kind of comes and adds to the team queue for the provider, if the providers are all tied together, right, on Teams. Now the provider can initiate a call, and the Skype call can be connected to Teams. So the Skype, and because Skype is part of the Microsoft ecosystem, it is all connected with Teams. Nobody has to do anything separate to start a Skype call, right? Yeah. Because it is connected. So the patient can initiate that, and it comes to a provider queue, and then provider picks it up and uses Skype to do the call. The other part of this is that we can use quick technologies like if somebody has a Salesforce, if some enterprise have Salesforce has texting mechanism that can be put on people's phones. So you can use Salesforce for queuing when somebody comes into the text channel, and that can be given to the providers as a small app, and Salesforce has this texting app that can be used for queuing. So what the provider is doing is provider has the Salesforce mobile app on the phone, which is used to really see who is coming through, and then use the EHR for documentation, and use any other video conferencing to do the conferencing like a FaceTime.
This is fantastic. I mean, what are you finding the response being from doctors? So some of these, a lot of doctors have used televisits, to be fair, but it didn't have wide adoption. I mean, if we're just honest, I mean, we were just ticking above, nominal numbers, and then all of a sudden now our numbers are through the roof. How are doctors feeling about it? How are they responding to it? How are we getting them enough training and those kind of things?
So I think the way I'll say this is the need has brought us all together.
Yeah. So
people are doing extra hours to train themselves. Even if I send a document to them, they just look at the document and say, San, I'm ready. Just to give you some perspective, in last 1 week, I have onboarded 970 physicians on telemedicine.
Wow.
970.
Yeah, that's amazing. We're not pushing any technology, but what was your platform before this? I'm sure it was a well thought out telehealth solution. It wasn't what you're doing now, but what was your primary telehealth solutions?
It was Amwell that we started off with.
Yeah.
So I started off with Amwell, and now because we have to scale up so much, first of all, Amwell is basically, we are using it for primary care, but within the hospitals, we are using Microsoft Teams, we are using Skype and other technologies that we can bring together. So we have brought all these things together on the hospital pretty quickly. And Amwell, we are we have ramped up 970 primary care providers in 7 days.
Yeah, and this is the exciting thing about this time is you got health IT is really shining at this point. You guys are MacGyver. You're sitting there going, all right, what do we got here? We've got this, and you're pulling it together. Are there other areas where you guys are sort of stepping in and trying to help with solutions to challenges that are? I'm sure there's just challenges popping up all over the place.
Yeah, so one of the things that we are doing is we have stood up a texting app for COVID-19. Specifically, this is a SMS text-based app, which is called Hospital to Home. So anybody can download that, and if you are part of our patient list, you will get access to that free for whatever time it is needed. And once you start texting, you will basically have a response from an emergency physician within 30 seconds.
Wow.
Okay. So this helps on the access part of this to really route the right patients in the right place. Because
so was this
is not the answer.
The texting application, was this something you already had in place, or something you guys had to go out and source once this came up?
So we already had a texting app that we had developed for hospital to home, people who are coming out of our emergency room and giving support for 7 days. We rebranded that completely to support COVID-19.
Yeah, that's interesting.
In 3 days.
So what are you doing for your single point of truth? So one of the things that's important in the health system is that everybody has access to the same similar information, if not the same information. So everybody's up to speed on what's going on in the community, in your hospital, things like, inventory on, you name it. There's a lot of inventory issues that we're looking at, time for tests to be done. What technologies or what mechanism are you using to keep everybody informed?
So I think we use something called Community Plus in Salesforce, because we are a Salesforce shop. And what we are doing is we are trying to bring the Community Plus up and get all the feeds that we need from the community into one place so that we can all get informed. That has really helped us. And it was given by Salesforce pretty much, to us free of cost to ensure that we can handle the situation better. Also, the way we're democratizing access to EHR, which is epic for us. Said that we have told providers, you can go and do your documentation, and as long as the documentation is in some format, we'll pull it into EHR, and there's a team to do all that today, so that we don't have to bog them down in terms of doing documentation in the right format.
Yeah, and just to close out, because we're trying to keep these conversations pretty tight, because we know that people don't have a lot of time, and we want to give them access to things. What do you? You're in the Dallas marketplace. Well, actually, you're in a bunch of marketplaces, but Dallas being home for you guys. What are you guys experiencing right now, and where are you at? So we are at Tuesday. Is it Tuesday? No, it's Wednesday, isn't it?
Wednesday, yes.
Wednesday. Days are meshing together here, but so it's the 25th on Wednesday. What's the situation like in Dallas at this point?
So we have reported, and they have reported saying 5,000 patients have been tested, kind of person of interest, positive. And we are seeing the influx into our hospitals and phone calls in terms of our contact center, help center. So we saw about 800 patients in last 2 days. People who are of interest or somebody who has tested positive, and that number continues to grow.
Yeah, but you're at the front end, so this is a very manageable number at this point.
That's right.
Yeah. So, thanks. I really appreciate you coming on the show. I appreciate you breaking the telehealth thing down. I think it's important to understand, in most cases, if we didn't have everything buttoned up and we went to the physician community and said, hey, here's our telehealth solution, they would have looked at us and said, go back and keep working on it. But in today, necessity is the mother of invention. And they are, what I'm hearing from the field is physicians are extremely happy to adopt, really well thought out solutions, but maybe not all tightly integrated like we normally would deliver to them.
Right. I think the word I'm going to use, Bill, is let perfection not be your enemy at this point. And telemedicine is a game changer. It is needed at this point to really help and distribute the care that we need. And I stand it to really help whatever is needed. If any health system, regional health centers who are looking for help, I'm ready to help to really kind of get to the situation here. And I know some of those things can be pulled together to really help. So my appeal is, do not be shy. It is not to be perfect. Get whatever you have to really help your communities.
Sounds good. Well, thanks, San. Is there any way people can get in touch with you?
Yeah, so I am on LinkedIn, and my LinkedIn profile is San Banerjee. If you just look it up, and then my email address is san.banerjee@outlook.com.
Fantastic. Hey, thanks again for taking the time. I really appreciate it, and we look forward to catching up with you after this to see how much of this stuff becomes a part of the normal operating procedure. It'll be interesting.
Absolutely, Bill, and always good to talk to you.
Thanks. Take care. That's all for this episode. Special thanks to our sponsors, VMware, Starburst Advisors, Galen Healthcare, HealthLyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, or the YouTube channel as well. If you want to support the show, the best way to do that is share it with a peer, however you do that. We're going to be back again tomorrow and the next day. We're going to keep dropping episodes with around solutions and with influencers who are going to help us to provide meaning around the different things that are happening during the pandemic that is going on. Thanks for listening. That's all for now.